Hi, this is Dr. Kristen Watkins. Sorry about the technical difficulties. And now I'm in the grass, as you can see. I know, so weird. Okay, so I'm here to talk about hormone replacement and sexual wellness. And I wanted to do this in a lunch and learn and make it easier virtually so that those of you who could join, who maybe couldn't come into the office or really didn't want to come into the office to talk about this particular subject. Sorry for all of the issues. Huh. Okay. So, I love doing this talk, and I especially wanted to target it for men because we offer so many things for men at aNu, and we have a very large population of men. So, we do everything from wellness services like testosterone, peptides, P-shot, Z-wave, hair restoration, medical weight loss, all the way to our aesthetics with Botox, laser hair removal, facials, all rejuvenation, body contouring. And we, like I mentioned, we have a lot of men that are patients. So I really wanted to tailor this for you all. I hope some of you asked your partners to join too, or you can, women can hear about this as well. So men get a free B12 shot or a fat burner turbo shot for virtually attending. And we did get a list of everybody who had signed on. Plus, those of you who signed on get entered into a raffle for a $250 dad credit towards any service in July and aNu. So that's for the men that joined. And again, we have a list. I am going to go ahead and publish this everywhere. And that way, anybody who wants the information can also have it. But we do have a list of those of you who joined virtually. So, does this look familiar, right? How can you get yourself back? As we age, things start to change. I don't think I realized that as much when I started medicine, but as I'm aging along with my patients, I definitely understand the aging process. And everything we do at aNu is very anti-aging driven, whether it's on the outside or the inside. So the aging process is considered unavoidable. Okay. But in recent years, especially with the type of medicine that I'm able to do, and others across the nation, hormone replacement has helped to delay the aging process. Again, there's a lot of things that do that, but we're going to talk about some of them today. So, what are hormones exactly? They are proteins or derivatives of cholesterol that are manufactured in the endocrine glands. Poor cholesterol gets a bad rap in traditional medicine. There are a lot of good things about cholesterol. So, if your cholesterol is suppressed, especially for men, to a point where your levels are very low, you actually are not going to be making testosterone or other hormones because it's going to be suppressed. Then they are manufactured in endocrine glands. Endocrine glands are everywhere. It starts in the brain from the hypothalamus and the pituitary, goes to the thyroid, also goes to the pancreas, which secretes insulin, the ovaries, the gonads or testes, the adrenal glands, everywhere. Okay, so we have so many hormones and very, very active endocrine system. So these molecules are released into the bloodstream and they exert profound biochemical effects on organs and cells. Right, I just mentioned a lot of hormones that are affected, and they affect every single cell. And they have very different actions, and some actions that are synergistic or duplicative, depending on the cell types in different tissues. So, what happens with the aging process? We have a decrease in production, a decrease in receptor sites, decrease in stimulation, eventual cell destruction and apoptosis as we age due to toxins and just the aging process known as oxidative stress. And then we have a deficiency in hormones, which creates more of the aging process. So, what can we do? We have bioidentical hormones that slow the decline of hormone loss because we can replace them and allows us to stay resilient and more vital. So the key is really to replenish hormones to an optimal balance. A lot of times patients will come from their doctor and say, well, my doctor told me that we don't need to replace certain hormones. And my answer to that is, but we replace thyroid hormone throughout the entire lifespan for men and women. So why wouldn't we do that for other hormones? We're trying to control insulin for insulin resistance, diabetes, weight gain. Why wouldn't we look at the other hormones for optimal life? So when you get your labs back from your doctor and they say, quote unquote, your labs are normal, if they looked at your thyroid, etc. The problem is that that doesn't mean optimal. There's a very, very large range from LabCorp and Quest and other labs that say, this range is normal. And for hormones, that can be, especially testosterone, anywhere from 40 to 1200. Okay. And I'm here to tell you that that huge range for any hormone or any vitamin or nutrient is not optimal. You may be low normal, very low normal. You may be on the very, very end of that scale and it not flag, but that's extremely low normal. So it is not optimal. The other thing is that most physicians do not check hormone levels. They don't check the full thyroid panel. They don't check B12, vitamin D, nutrients, etc. Just not how we're trained. Signs and symptoms of aging. I'm sure you could tick every single one on here, or at least have fatigue, wrinkles, mood changes, depression, vaginal dryness if you're a female, erectile dysfunction if you're a male or female, decreased strength, bone density, increased visceral fat, weight gain, decreased memory, concentration, brain fog. You can't control all those open tabs that you used to be able to in your brain. Hot flashes, hair loss, sleep problems, decreased libido, problems with sexual function. Yeah, check, check, check. Okay. So a lot of times I get asked, well, why doesn't my doctor, my regular doctor, address that, right? Why aren't they talking to me about the things you're talking to me about? Well, unfortunately, it's because in medical school, we do not learn about bioidentical compounds or supplements or vitamins or nutrients because they're not pharmaceuticals. Okay, they're natural compounds, and most of what we're taught in medical school as MDs are pharmaceuticals. Okay. So if we want to do this type of medicine, we have to go out and do our own research because we're not taught in medical school. And I know that that seems crazy, but doctors are actually not taught about nutrition, vitamins, minerals, supplements, hormones, unless they go to something like a naturopathic medical school. But those of us that are allopathic, MD or DO, we typically are not trained. We're also not taught much about preventative medicine. So we're typically only taught about screening tests for cancer, mammograms, pap smears, vaccines, and then of course your blood pressure and your cholesterol. And most people, most doctors and the population have been afraid of hormones ever since the Women's Health Initiative. Okay. The difference is that the Women's Health Initiative was synthetic hormones, meaning they were not bioidentical, they were pharmaceutical. So that trial was going on for a long time. And at one point, right, it was not stopped. Actually, it's still going on, different arms of them. There became a huge controversy in the United States about the Women's Health Initiative study and some of the findings. And actually that arm of the study was stopped. And that's because the synthetic estrogen and synthetic progesterone that were used in Prempro, Premarin, Prevera, etc., were actually causing problems. Okay. So Premarin that was used in it is a synthetic estrogen with 10 different estrogens that are completely foreign to the human body. So we don't even really know what they are. They are derived from a pregnant female horse urine. Okay. That's where synthetic estrogen came from in Premarin. Still does to this day. Okay. Prevera, the one that was used was synthetic, and Prempro was a combination of both of them. And what was found and why that arm of the study was stopped and why there was a big media and physician alert, most people were taken off of synthetic hormones, if not everyone, because those synthetic hormones showed an increased risk of heart attack, stroke, blood clot, okay, if over the age of 60. And the combination of the two increased the risk of cancer and heart disease, okay? So where does that lead us with bioidenticals? Everybody, the pendulum swung and everybody was afraid of hormones. The thing is that there's no increased risk in bioidentical hormones in the studies. And actually, bioidenticals can decrease the risk of Alzheimer's, colon cancer, heart attack, stroke, osteoporosis, and lower cholesterol and glucose, along a myriad of other beneficial things. So yes, bioidentical hormones are completely elective and optional, but I always ask my patients, if you could decrease the risk of these things and improve your health outcomes and longevity and vitality, wouldn't you do it, right? And they always say yes. That's why they come to see doctors like me. So what happened was the media and doctors, like I mentioned, they really feared it. We were not taught about it in medical school. So most physicians just do not routinely talk about it or prescribe it due to lack of knowledge and training and honestly fear. We were told that they're bad. So natural or bioidentical hormones, they're not interchangeable with synthetic hormones, okay? They are not the same. Bioidentical is what your body makes, and they can't be made or patented by pharmaceutical companies. Therein lies the problem, okay? So they are very poo-pooed, but they work very, very well, and all my patients will tell you that it has definitely changed their life. So they're made with natural ingredients. And they can be made into a form of a capsule, a cream, a troche, an implanted pellet, or an injection. Okay. And every hormone has a different form. And the way I'm trained, there are certain hormones that I will deliver in certain ways, and some hormones I won't deliver in certain ways due to not only efficacy, but safety profile. Thyroid, obviously secreted by the thyroid gland in the neck, regulates everything. Okay. When something's wrong with your thyroid, everything is off in the body. Temperature, metabolism, brain function, fat, cholesterol, hair, nails, skin, energy levels, stool, you name it, it's affected by thyroid. Okay. Here's some symptoms of low thyroid: fatigue, lack of energy, being cold, weight gain, forgetfulness, confusion, depression, right? The problem is that all of those can look like other things. So I was alluding to this earlier, but your primary usually only checks a TSH. That's how we're trained. That's thyroid stimulating hormone that's secreted by the brain that does not look at what the thyroid is actually secreting, which is T3, T4, which is then broken down into free T3 and free T4. And then the free form is the more bioavailable, the one that's available to go work on all the cell receptors. Okay. So I really look at free T3 as a very big indicator of thyroid dysfunction. And we know that when your free T3 is low, it's associated with chronic fatigue. Okay. And I don't just prescribe Synthroid or levothyroxine, #1 prescribed medications in America. Sometimes I do, but almost everybody needs T3 with T4. It just depends on the patient. So sometimes we will do the natural ones, and other times we will do levothyroxine alone or levothyroxine with side amounts, because some patients only need T4, some only need T3, but most need both. Basically, this just tells you the exact same thing, right? We know in functional medicine or wellness anti-aging medicine that really looking at the full paradigm and what the thyroid is actually secreting is the best way to diagnose and actually find full thyroid problems and treat them. Estrogen, yep, produced by ovaries and adrenals, and men also make estrogen by the conversion of testosterone to estrogen, okay? We actually don't want that in a male. We want to limit that amount. So for patients that come to us from other facilities, a lot of times they are over testosteronized, meaning they are also over estrogenized, because testosterone converts to estrogen in a lot of men. And if that's not monitored and checked and either testosterone decreased or blocked, DHT is blocked, then they can have high estrogen problems, which a lot of men will hear about, such as shrinking of the gonads or testes, male breasts, mood, irritability, but also that can have effects on the heart, because men should not have elevated estrogen levels. So it's really about balancing and making sure you're seeing a well-educated physician, medical provider that understands the benefit of hormones and the limitations and where they should stop, or where that ceiling is of efficacy and safety. More is not always better. Okay. So estrogen benefits: muscle tone, wrinkles, dry skin. Women will definitely comment on that as they're starting in their 40s and 50s losing estrogen, but it's men too. Mood, libido. When your estrogen is at an optimal level, you have a decreased incidence of dementia, Alzheimer's, decreased risk of osteoporosis, decreased bad cholesterol, increased good cholesterol, so on and so forth. Okay. Progesterone is a female hormone produced by the ovaries and is used to balance estrogen. Men have a little bit of it too, but it does not play a big part. Women, very, very, very important hormone, one of the first to lower as we're aging. And a lot of times now it's lowering even it's low in our teens and in our 20s, okay? For a myriad of reasons, including toxins, endocrine disrupting medications, foods, chemicals, products. So progesterone, I treat a lot of low progesterone in my younger female population. Low progesterone usually are things such as PMS, PMDD, ovarian cysts, infertility, you name it, low progesterone starts at a very young age. So when we give patients testosterone, if they need it, it really helps with mood, irritability, headaches. Also helps, as you can see, with osteoporosis, cholesterol, also offers protection against uterine cancer and breast cancer. Okay. The other great thing about progesterone is a lot of women, when they start menopause or perimenopause, have problems with sleep, and it acts as a mild sedative when it crosses the blood-brain barrier and helps you sleep. So one of the first signs and symptoms of menopause is actually where we start to have problems with sleep and mood, and that's typically due to low progesterone. Testosterone. Yes, it's men and women. Okay. Females have testosterone too. The difference is that men make about 10 times more testosterone than we do, and we make about 10 times more estrogen than they do. And our levels vary and fluctuate a lot more. Imagine that. So testosterone is secreted by the ovaries and the adrenal glands in females, and the testes or gonads in males. So what does it do? Obviously, we know it can help with libido and sexual function, but more importantly for most females and males is that it helps with energy, helps with mood, it helps with that well-being or zest of life. I really call it like the stamina, right? The feel-good Superman hormone. Also helps with muscle tone, exercise tolerance. It really is an important hormone for men and women. There's been there's a lot of bad rap about testosterone in the media, and physicians still believe some of these old things that are not true, but it actually does very much help with cholesterol profiles, and actually helps prevent cardiovascular issues in men. Okay. So DHEA is another one, produced by the adrenal glands and derived from cholesterol. It is a mother hormone. Men and women need it. A lot of places do not check DHEA. And sometimes we don't have to give men or women testosterone just yet. If we elevate their DHEA and get that up, that will naturally bring up their testosterone levels. Okay. So it's one of the most important hormones, and low levels of it are definitely increased with mortality from cardiovascular disease and cancer. Those are a lot of studies that have been done. So it improves immune function, stress, anti-cancer, energy, reduces body fat, helps with insulin sensitivity, protects against diabetes, extremely anti-inflammatory. In my autoimmune patients, I see very, very low levels of DHEA. They don't even know they're autoimmune yet. I haven't even done some of the testing yet. And when they have low levels of DHEA, that's very much contributing to their pain and inflammation, okay, and fatigue. Patients that receive DHEA sleep better, more energy, handle stress better, better immune system, anti-cancer, anti-atherosclerotic, meaning it lowers cholesterol and helps reduce inflammation in the arteries, and cognitive or brain enhancement. Melatonin, everybody's heard of melatonin for the most part, secreted in the brain and the pineal gland. It regulates sleep. Most people don't know this, but at very high doses, it helps with cancer and immune function, decreases jet lag, and it actually can slow aging by promoting good sleep, because sleep interference definitely causes problems with mood, with weight regulation, with cortisol, with hormone imbalance, etc. It's available over the counter and prescription. So I have patients that some of them are on over the counter, some of them are in a compounded medication with their other hormones from the compounding pharmacy. Okay. Pregnenolone is the first hormone made by cholesterol, so it kind of controls the cascade from there. Very important in brain, memory, brain fog, concentration. Okay, so it should be checked by your doctor, and your body should naturally make it. However, as we age again, it declines, and it's not found in food, so it's very hard to replace on our own. Okay. So basically, in summary, I think, and I can reference hundreds and hundreds of studies that, go against what we've all been taught from the Women's Health Initiative, or we're told, I should say, in the one arm of the study that, hormones were harmful. Synthetic hormones can be quite harmful. And even bioidenticals, if your provider does not know what they're doing and are over prescribing them or not monitoring them appropriately, everything needs to be at a physiologic appropriate dose for safety and efficacy again. So men and women who were in this study had a positive response to bioidenticals. Only the control group that was not on hormones had significant detriment with symptoms, etc., due to aging. Okay. Thousands of studies. on bioidenticals have shown impressive and dramatic improvement in the decrease of disease and improvement of the aging process. What do we do, right? What else do we think is important? We don't just check hormones. I don't think that's the entire basis of feeling well and getting better. It's diet or nutrition, right? Exercise, stress reduction, nutritional vitamin, mineral supplementation. Okay, so it really is the whole paradigm. The 4 pillars of functional medicine are nutrition, physical activity, stress modification or reduction, and sleep. What did I say? Sleep, stress, nutrition, physical activity. Okay, those are the 4, and they're so important. But we do have to supplement with other things, right? We don't get everything from our diet anymore, and we are aging. And so we're living longer, but we're not necessarily living healthier in America. How can a physician like me help you do that? Okay, and live with more vitality, etc. So why wouldn't you try it, right? I think the only answer to this question would be if you're not with an appropriate prescriber. So just make sure it's, a board certified physician or their team that really can help you on your journey. What do we do here? So a lot of people say, what is functional wellness? It's a blend, integrative functional wellness. Basically, what I call it is precision medicine or personalized medicine. I don't have 2 patients on the same plan. It's really where the physician or the medical prescriber and the patient partner together in their health, right? I am the coach, but you have to go home and do all the things. Very different than just taking a pill. It's very important that it's comprehensive wellness medicine. Okay, what about all of the treatments that we can offer for sexual rejuvenation, right? Why pick aNu? There's probably plenty of other places now. There definitely didn't used to be. They're doing some of these things. So I'm a national speaker and trainer for regenerative medicine with PRP, ozones, exosomes, previously stem cells. I have over 8 years experience in regenerative medicine. Our procedures are only performed by myself or medical staff that have been trained by me. I'm always researching the best PRP and exosomes, the best results, the best outcomes. I am definitely a self-proclaimed nerd and love regenerative medicine. Okay. I also have all of these services done for myself. And I think it's really important that I do them on myself, not me on myself, but have them performed so that I know what you experience. And I would never do anything to you that I won't do to myself. And that includes exosomes, PRP, IVs, etc. Okay. I am certified and trained in all of these procedures by Dr. Charles Reynolds, who is the inventor of these procedures. So the P shot. So what happens with erectile dysfunction? Lots of things. Okay. It's not just, oh, my testosterone is low. It's that, but also low thyroid, low DHEA, low pregnenolone, like we just talked about, too high of a conversion to estrogen, low thyroid, cardiac issues, meaning actually vascular issues, inflammation in the vascular tissue. And remember that erections are just blood flow. So if you're taking blood pressure medications or have high blood pressure, have cholesterol issues, have blood sugar issues, all of those affect the blood vessels, create inflammation, and will decrease blood flow and efficacy of erections. The other thing, again, are meds, right? There's certain medications that decrease efficacy of erections, including blood pressure meds. And we talked earlier about statins or lipid controlling medications that lower your testosterone too low, thereby inhibiting you from making hormones. Okay. The other thing, obviously, is lifestyle, diet, exercise, weight loss, smoking, alcohol intake, marijuana. All of those things matter because they have an effect on inflammation and your blood vessels. Okay. So what can we do about it? There are medications such as Viagra and Cialis, of course. Most men have tried that before they go the next route. And a lot of my patients do all of it because it's synergistic. Okay. So when we talk about erection, there are different levels. Okay. And we definitely do a questionnaire because we want to make sure we're addressing the appropriate thing with our patients. Because I even treat patients that have Peyronie's, which is actually a penile fracture, or where the fibrous tissue, there's issues, and men who have had prostate surgery for cancer or biopsies where we need to help with erection and they have more serious conditions. And P-shot and shockwave, which we're going to talk about, actually help all of that in addition. Okay. So the P-shot enhances sensation, arousal, and orgasm, helps correct erectile dysfunction or treat it, increases length and girth, depends on the patient. It's more so girth. Okay. Helps Peyronie's disease, which we just talked about. What we do is we draw your blood, spin it down, inject it, and then your own growth factors take over to enhance blood flow and something called neovascularization, which means we increase blood flow and increase nerve supply, because wherever blood is, nerves follow. And so that helps with blood flow and helps with nerve supply, thereby helping sensation, arousal, erection, not just the amount of erection, but how long you can maintain an erection, firmness, etc. Okay. And the good news is it's extremely comfortable, no downtime, almost no pain. Okay. So talks about here again, we draw the blood, from you, which ensures that there's no risk of rejection. It's spun down with a special tube to extract your growth factors. It's injected back in after we numb the area. This is very true. Nobody believes us till they have it done. There's little or no discomfort to the procedure. It's very safe in a very sterile, safe medical environment here. Virtually no side effects. Okay. Tolerate the procedure, works very, very well. We're very successful with this treatment for men. And you get all the benefits with no pain, almost virtually no risk, and 30 minutes of your time, with only about a 3 to 5 minute procedure. Actually, drawing the blood and spinning it down takes longer than anything. PRP, exactly what we talked about, right? Platelet-rich plasma helps signal your body's own growth cells to jumpstart healing, repair, rejuvenation of that tissue, the blood flow, right, and the nerves. You can see it right here. We get the red blood cells to the bottom, and we do not use the red blood cells, okay? We want that platelet-rich plasma with all the growth factors. What else do we do? Acoustic wave therapy, also called Z-wave or shock wave, lots of names for it, Gaines wave. It helps correct erectile dysfunction and Peyronie's, and typically we recommend multiple treatments with ultrasound. A lot of our patients do the combination where we do the P-shot with acoustic wave energy because they're synergistic and help each other, right? So again, here's the names: sound wave, acoustic wave, shock wave, Z wave, and Gaines wave. There's a lot, but wave. So it's radial low wave energy pulses in ultrasound form, increases blood flow, relaxes fibrotic tissue. We typically recommend 6 treatments, 2 a week for 3 weeks, takes 10 to 20 minutes, and enhances the results of P-shot. You can absolutely do it by itself or in conjunction with P-shot. Here's how it works. Okay. Again, it's all going to come back to blood flow. Okay. So if you want to be the nerd like me and look at the middle portion where we talk about nitric oxide, and remember, nitric oxide, or NO, is increased by Viagra and Cialis. That's how it works. Everything we do in this realm of treatment has to do with increasing blood flow to the area. It's just that they all can be synergistic, such as Viagra, Cialis, P-shot, shockwave, and believe it or not, for other patients that have more severe conditions, also doing the injectables into the penile tissue. It's very rare for our patients to do that, but we have some that have more severe cases that also do that. What about testosterone replacement, right? What happens when your T is low? It's not just low T, low libido, erectile dysfunction. I call it kind of like the Eeyore syndrome, or meh, the emoji meh. Low energy, mood swings, your body starts to change, you lose muscle, you get more fat in your belly. That's low T. So it should be checked. And remember, like I mentioned, LabCorp and Quest, the range can be from 200 to 1200. Okay. That is not the optimal range. 200 is not optimal. 400 is not optimal. Benefits of replacement, to help with all the symptoms I just mentioned, right? So to help with erectile function, to help with hair, collagen, skin, bone mass, muscle, strength, endurance, also mood, memory, right? Also helps with lowering cholesterol and helps reduce the risk of cardiovascular disease. All right, women, Thermiva. So this is a non-surgical, painless solution for feminine rejuvenation. Who wants treatments? Perimenopausal and menopausal women who have dryness, leaky bladder, laxity, women on cancer treatments because of the dryness, okay? Post-pregnancy because of laxity, bladder leaking, bladder falls, all right, or decreased sensitivity. Also women who have difficulty achieving orgasm, or low sensitivity, or, prolonged time for orgasm, etc. Any sexual dysfunction. So if you feel dry during intercourse, trouble reaching orgasm, leak when you sneeze, cough, or exercise, or feel loose since childbirth or menopause, it's for you. Again, painless, safe, non-surgical, no downtime. Improvements after the first treatment. For your first series, we do 3 in-office treatments once a month for 30 minutes. And typically women ask, how often do I have to do this to maintain it? Same question with P-shot and shockwave. Depends on you. Sometimes once a year or every 2 years. I have a lot of people that push it out to 18 months to 2 years. And I have some people that come in and get treatments every 3 to 6 months because they want to. Okay. We already talked about that. Totally painless. There's 0 downtime. You can resume sexual activity, exercise, hot tub, whatever it is you're doing that day. Same for shockwave, same for O-shot and P-shot. You see results even after your first session. And again, there's your upkeep. The study that was done when this device came out. Now there's lots of devices out there. There's the Diva. I don't even know. There's like, 20 devices out there, but they essentially all do the same thing. Okay. They work on blood flow, neovascularization, nerve supply, and tightening with heat. So the women that got this treatment, when this study was done back in 2015, and we still use this method to this day because it works significantly. Significant change, would do it again and recommend it. Very happy, no complications, comfortable, no downtime, okay? Over 50% reduction in symptoms. That's huge when you're talking about leaking or laxity or libido orgasm problems, sexual dysfunction. Same here, right? Things that we're able to improve with Thermiva, we've already addressed them. I know men look away, but it can really help. I'm not afraid of these things to show you all. Okay. 3 treatments, 30 minutes. For all these treatments, if you have a medical indication, you can use your HSA or FSA card since I'm a physician, right? And we talked about touch-ups, but they're very patient dependent. Every 1 to 2 years for any of these things I'm talking about. And again, I have some men and women that are frequent flyers. O-shot. Helps with pain or discomfort during sexual intercourse because a lot of times that's caused by dryness. Increase in sexual desire, stronger, more frequent orgasms, reduction or even elimination of incontinence, and to get off those meds that make you more dry. Same thing here as the P-shot, right? Painless, natural way to help with your vitality, sensation, vaginal clitoral function, improve sensitivity, enhance your sex drive, but also urine incontinence. Same thing here, right? We do numb you. I know it sounds like there would be pain when we're injecting the clitoris and where the G-spot is, right under between the bladder and the vagina, but literally, if you feel it, we're probably not doing something right, okay? You really should not feel it. Maybe a 1 or a 2. You really should not be uncomfortable during these procedures, okay? Again, 5 minutes. You're here for longer than that because we draw your blood and spin it down and numb you, but the procedure itself is very quick, 2 to 5 minutes, okay? Healing, regenerative. It's you. That's what I love about these treatments. It's you. There's no rejection. It's your body healing itself. That's what regenerative medicine means. Again, PRP. Again, the 2 areas we inject for women. Men, there are 5 injections on the penis, 4 on the shaft, and 1 where the head and the shaft meet for sensitivity. I know that all of this sounds terrible, but I promise you, not painful. Other options we have, right? Scream cream, oxytocin, PT141, peptides to stimulate growth hormones, topical things to help with vaginal problems. We have all of these options available to us. So all of our patients that see us for wellness have all these options as well. Okay. The freebies, don't forget, right? You guys that logged on virtually for the Lunch and Learn will get the free Fat Burner B12 Turbo shot. And those of you that were men get entered into the free raffle for $250, and we'll let you know who won that because that's freaking awesome. Okay, so We want you to feel confident and refreshed, right? We really, because it was June and Father's Day, we were targeting for men. And I thought about just talking to men today, but I really wanted to talk about both because, most people have partners, whether they're same sex or different sex. And I think talking about men and women is very important because if your sexual rejuvenation is fixed, but your partner's is not, then you need to know about that and know about the options to help so that you can have a balanced relationship. Because what happens is we get one person in here for hormone replacement or sexual rejuvenation procedures, and then their significant other follows because they want whatever Kool-Aid they have. Okay. So the June promos that end, I guess Friday. Ooh, it's almost July. Ooh. Okay. So the big one that pertains today is you get $150 off the P shot, and you do get a free virtual consultation with our nurse practitioner or doctors if you want. There's also the IV therapy, Vitality Boost, 20% off a pack of 3 IVs. Botox, I had a lot of men get this, $100 off your Botox or Botox treatment for men. The other thing is a hydrofacial with infrared sauna and IV therapy. That's a huge discount on that. And also hair revival. We do a lot of PRP hair restoration. We do a lot of microneedling, etc. with hair. Industry has grown over 400% in the last few years, and we've been treating sex rejuvenation and hair rejuvenation for over 8 years. So we're not new to this. We know what we're doing. We have great protocols and treatment options that really are all encompassing, and we add multiple modalities to make these things work. Okay, so that's it. Sorry for technical difficulties earlier, but thank you for joining. And if you have questions, you can always call us for a consultation. You can become a wellness patient. You don't have to become a wellness patient to get the procedures, but if you want the medication management, become a wellness patient. We love what we get to do. We're not afraid to talk about aging, hormones, and sexual wellness. We think it's a very important of life and vitality. So come see us.